Hello, lovely people. How are you doing today? I hope you're fine. It feels really wonderful relating with you again on this platform of health awareness creation. You're welcome back to Health Conference YouTube channel with Ness Mary. Compliment of the season. I just realized the environment is so green, and I thought of a wonderful thing to talk about, and I found fertility. So I want us to deal with infertility today. Come on, this video is not only for the married, it is not only for those who are having difficulty having children, it is for an adolescent who of course will get married someday, it is for a mother, it is for a father, it is for couples who are having difficulty having children. It's just for everyone. Trust me, it's for everyone. It's for a grandparent, because being aware of this information could help save your child, your grandchild, your neighbor's child. It could just help anybody. So trust me, this video is for everyone. Thank you. Okay, we want to look at infertility today. So first, what is infertility? Infertility, according to World Health Organization, is defined as a disease of the reproductive system, defined by the failure to achieve a clinical pregnancy after 12 months of regular unprotected sexual intercourse. After 12 months or more of regular unprotected sexual intercourse. So infertility, of course, could be primary, it could be secondary. We could say, okay, primary if you've not had a child before, secondary if you've had a child and then it's difficult having another child. Now, according to statistics, 1 out of every 4 women faces the problem of infertility, is faced with infertility. 1 out of every 4. Infertility has eaten really deep. Maybe in your surroundings, around you, you don't know of anybody who is having difficulty having children. But I tell you, every day, these people flock fertility clinics. Yes. So I feel we just need to talk about it today. Let's discuss it. Now, what are the causes of infertility? Talking about the causes or the risk factors, we have certain risk factors that are not modifiable. We have those that are modifiable. Okay, I wouldn't want us to spend a lot of time talking about those risk factors that seem we can't help. Talk about age. Of course, every woman's fertility reduces from her mid-30s, and then for the man from 40 years up, your chances of being fertile reduces. Okay, that's age. Now we can't do anything about it. We have some biological factors we really can't influence it. But what I want us to talk about today are those factors we can affect by a change of lifestyle. Okay, number 1 is, let's look at occupational factor. Some of us are exposed to such occupations that where we deal with some elements like lead, cadmium, mercury. Trust me, these elements can affect fertility. Overexposure to these elements can affect fertility. Vinyl chloride. Okay, by limiting exposure to this elements, this stuff, I'm not saying we should quit our jobs, but just look at how you can do it. Limiting our exposure to these elements can go a long way in protecting our fertility and help us stay green. Okay, let's look at lifestyle. There's several lifestyles that promote infertility. Talk about smoking, use of tobacco and marijuana. For the men, this reduces sperm production and motility. And then, of course, for women, it is harmful to your reproductive health, especially when pregnant. Some pregnant women still smoke, still do things, maybe because of the weather, but trust me, these things are harmful. Not smoking for a period of 9 months, of course, we should stop smoking, not only when pregnant. But let me just deal with the people who still smoke even when they're pregnant. Not smoking for a period of 9 months is better than losing your baby, or bringing up a baby putting forth a baby that has one disability or the other. Okay, that's smoking. Another one is excessive use of alcohol. No amount of alcohol use is safe. Trust me, men, heavy drinking has a negative impact on sperm production and motility. And now for the women, it affects your reproductive health. Yes, it does. It affects the baby in utero when taken during pregnancy. It affects them. Number 3 is drug abuse. Most of us take drugs even without asking. who, not just asking anybody, not just asking someone who has had that condition before. It is going to the hospital and seeing a doctor. You only take drugs that are prescribed to you, and not drugs that you feel have worked in the past or has worked for some other person. So drug abuse is harmful, especially during pregnancy. Research has shown that excessive use of acetaminophen, that's paracetamol, during pregnancy affects male fetuses. It affects babies in utero. It causes it has a negative impact on their sperm production. Okay, there's so many other drugs. Antibiotics. Sometimes we feel we have an infection and then we just take anything. We treat infections without doing a lab test, without doing a cultural sensitivity test to know which antibiotic this microorganism is sensitive to. Abuse of antibiotic can damage the sperm cells, even for women too. We talk about multiple sex partners or premarital sex. This can expose us to infections, and of course infections can talk about chlamydia, talk about gonorrhea, and so many others. STIs are harmful to our reproductive health. Yes, they are very harmful. Okay, let's talk about which other lifestyle. Okay, there's so many lifestyles that are harmful. There's so many lifestyles that are harmful to health. So let's just cut down on the things we do that affect us negatively. Let's talk about diets as a factor. Sometimes we take too much of junks and we end up coming overweight. Now, extreme weight extremes can increase our chances of going down with infertility. Being underweight or overweight. When you're overweight, this alters your hormones. It causes hormonal imbalance. This can even affect reproductive fertility treatments. So please, let's just take our food moderately and eat what is good, and not spend our time getting junks and stuffing ourselves with junks. Okay, now let's talk about disease factor. Now, there's some diseases that are primary to infertility. Talk about diabetes mellitus, talk about hypertension, talk about cancer. So let's see how we can prevent these diseases, because they can result in infertility as a complication. I think I've talked about a lot. Did I mention excessive use of OCPs, oral contraceptive pills? Now, use of oral contraceptive pills without prescription is not the best family planning method. Now, there's something common. I got to realize that so many people, so many ladies who are not medics know about Postino 2. Postino 2 is very harmful. It can cause breast cancer. Excessive use of it is only an emergency contraceptive pill. Well, please, that doesn't mean you work with this. Visit your doctor for any information you need. Postino 2, excessive use of Postino 2 can make you go down with breast cancer. It can alter your ovulation and menstrual cycle, and this can result in infertility. Let's talk about, now those are the preventive methods. Those are the measures we can take to reduce our chances of having infertility or facing infertility in the future. Now let's look at treatment. Now for whoever is already experiencing infertility, you've not had a child for 12 months or more, could be because of your age. You could even have outgrown your fertile childbearing age, or something has just gone wrong. Please visit your physician, your gynecologist. Visit your doctor and discuss this, and your doctor, together with you, will plan a better treatment method for you. But I'm going to mention some treatment measures. We have follicle tracking, ovulation tracking. We have, because most couples don't know when they should have sex, when they are most fertile and more likely to have children. So visit your doctor, and he or she could choose ovulation tracking for you if that is what you need. We have in vitro fertilization. We have intrauterine insemination. I don't know what your religious belief is about in vitro fertilization, but if you have religious restrictions, fine. Pray, and with faith, even as small as your mustard seed, the Bible says, will help you. The Lord will help you. But if you don't have any religious restrictions, please, you can do IVF. It is working. It is working at 2014, over 5 million children had been born through IVF. It is working. Please do it. And now, if you have any problem, maybe you've been told by the doctor you don't have a womb anymore, or something happened and the procedure needed taking out your womb, the whole of your womb, you did a hysterectomy, and then you've been told you can't carry a baby, there's an option called surrogacy. Yeah, it is true in vitro fertilization. Just visit your doctor and discuss, and hope will be rested. Please do this and stay green. We all need to stay green. You see how green the environment is. Please, let's stay green. Okay, have you subscribed to this channel, or you're just viewing? Okay, my utmost interest is getting the information, but please subscribe to this channel to get fresh video every Friday. Thank you.